My name's Jim Turner. I'm professional lead for mental health nursing at Chef Hallam University, and I'm sure a lot of you probably know me from some of the wellbeing work that I've been doing across the College of Health Sciences and the university. I want to talk a little bit today about houseplants because I'm quite committed to them. I'm surrounded by them actually. Got one here, and in my office normally at Collegiate, I've got quite a lot of houseplants, and I propagate houseplants for people. Because I've got this, and the spider plant here is one of my babies that I give out to people. Because I'm quite committed to making sure that our buildings and spaces have all got plants in them. And it started many years ago with Professor Mary Jo Kreutzer came from the Institute of Wellbeing in America, and she was talking about how they had houseplants in hospitals, and green spaces in hospitals, and how that contributed to general well-being, as well as physically detoxifying some of the atmosphere. And it got me thinking that as I walked around our university, there weren't enough houseplants, so I started to propagate them for people. So, what do we know about houseplants and mental health? Well, there is a lot of interest at the moment around green space and social prescribing in green space, around outdoor activities and groups and the like for mental health. And often this involves nature, but actually it also involves green space with houseplants, which have got two key benefits, I think. One is to well-being, and one is to physical health. So what does the evidence say? Now, I only did a brief scan of the evidence for this, and this is one of my easy propagators here in the picture. It's a pyrrhea. It grows little tiny babies, and you just pluck them out and pop them in another pot, and they grow. So Zambov and et al. During the pandemic have found that student nurses, or not student nurses, but students having more houseplants or a garden was associated for some of them markers for mental health. Mims, in an unpublished commentary, noted the positive impact of houseplants on mental health, and it was blending in art and houseplants. It was quite technical, but quite interesting. Hay noted the conceptual framework of green care, whereby contact with nature is noted as important to human beings, and Han and Ruin found the synthesized results of the review of their studies. They did a big systematic review and showed that that was noticeable effects of indoor plants on participants were increasing positive emotions and reducing negative feelings, followed by reducing feelings of discomfort. And I think that literally in a few minutes I scanned the available research and came up with these four studies. But interestingly, there were studies also on not just mental well-being because of houseplants, but studies around the environmental impact of houseplants on what is called sick building syndrome. And fundamentally this relates to new builds and many offices where carpets are glued to the floor and the furniture is glued together. And what the suggestion is that they emanate vapours, and some of those, formaldehyde being one of them, and some of those can be harmful to health. Of course, one of the main things they found was that if you open a window and ventilate, then that helps get rid of those vapours. But they also found that generally houseplants increased humidity in the rooms and decreased carbon monoxide and carbon dioxide, which is a good thing, I guess. Matsumata looked at placement of houseplants in university halls of residence, again because they're industrial type buildings, then they'll have carpets that are glued and furniture that's been glued. So they noticed that houseplants there as ecotherapy promoted psychological well-being of their college students. And Kim et al. Now Kim et al. And the other authors are actually doing an awful lot of studies into sick building syndrome. And they surveyed the possible benefits of indoor plant intervention on the indoor environment, and the results were inconclusive, but actually it was an interesting study. So here we are in Horticultural Week. So this is my first presentation. I'm going to do another one on propagation if I get some time, but I just thought if you haven't got a houseplant, then I think, especially now we're working from home, get one and plonk it next to your computer. And I'm sure you can appreciate it for what it is, and also it'll have some health benefits. And if you haven't got a houseplant and would like one, get in contact with me, james.turner@shu.ac.uk, and I'll propagate one for you. Or you can I've got 4, I think, ready for collection. So I hope that's been helpful. Bye bye.